start with the chat. With that, we'll get an idea about the family status, socio-economic status of the patient, and expectations of the patient. So, I want to drive, 80-year-old person, I want to drive at night. So, you can keep that in mind. And you want to read attitude of the patients, where they are the misers, they are really care about their parents, or they are just, onlookers. And who brought the patient to the patient. So, the patient's father or mother or brother or a relative has undergone a procedure in a hospital, and they are coming to you. That means they are happy patients. So, the counseling is easy for you. So, how does it start? How do you start the counseling? This is what starts from the basics. The dictum is nail the basics, details later. So, even the most educated person, like a professor or a software engineer, he does not know. He may not know what a cataract is. So, he is aware about the cataract, but so he should explain the disease with the help of models, animations, and he can put a word on the surgery. We are doing phaco. Phaco is something which is a very commonly done case, but it has its own complications, but it is it's very less. And this is the time where you have to tell good word about the surgeon. The surgeon is so and so is doing surgery. He has a lot of experience. He has worked there. He was working in Angamali. He was working in the different places. He was trained in such a place. And we have the best equipments with us. We have been operating with maybe the Alcon Centurion in gold. So we have a picture of that mission there and the facilities, etc. And then start talking about IOLs. So first, then you go for IOLs. So every hospital has a long package list. Before the dictum was lesser the number of packages, it will be easy for the patient, but it is not possible now. The advent of monofocals, trifocals, and EDOF and Torics, and minimum 12 packages will be there in each and every hospital. That is minimum thing. But in our hospital, we have 22 packages, including economy and medicine packages. But we don't show them. We only show this small picture. So the basic IOLs, we talk about the basic IOLs, monofocals, trifocals, EDOF, and explain the benefits. We don't talk about Toric then we see the chart or the record, and if the patient is having an astigmatism, then we mention about the Toric, then only go for company and cost counseling. So, explain about the IOL in detail, which we had done already, and talk about the advantages. Use only positive words, no negativism. All the IOLs in the hospitals are good. They will give you 6x6 vision, full vision. But if you use this particular type of IOL, vision will be sharper or clearer. Or if everything is a safe procedure. If you use a preloaded one, it is more safer. So, you should tell like that. And you always use models or computer animations and brochures. And always there is a confusion regarding Indian and important things that we have to clear out, telling that Indian is good, it's always good. But this is the important one, is worldwide people are using that. It's a time-tested one, you can tell like that. And irrespective of the socio-economic status, you have to give all the options. So, like what they say, you cannot judge a book by the cover. You cannot judge a person by his appearance. A person may be poor, but he will be willing to pay for his mother or father. But opposite, vice versa is also there. And adamant mentality. So my father has been fixed with this IOL. So I want this IOL. My brother, no, not like that, sir. I know your father is having good vision, but that time this type of IOLs were there. Lenses were not there. You take time to explain about the IOLs even to the most adamant person. Then you go for the cost counseling. Because by the time you have already explained about the benefits, you know you have an idea about the economic side of the patient and mental side of and the bystanders, then explain the package concept. So, a patient, this is the surgery cost 30,000 rupees. 30,000 rupees. So no, this is not the cost of the IOL. This is the cost of the procedure. So, we do surgery, the surgeon's fees, theatre charges, all this, everything is included. That package concept should be there first. Then you have to make sure that there are no hidden charges. Even the richest person will maybe sometimes irritated if they have some hidden charges or unexplained cost at the end. So after surgery, there will be some charge for the like anesthetic cost, there will be extra, or for medicines you have to pay. Everything should be transparent that time. And if the patient is having an insurance policy, do your maximum to avoid that policy and direct the patient to the insurance officer. That is the headache of insurance officer. Counsellor cannot do more than that. Then they have chosen a IOL. Make the patient happy unconfident about the IOL they have chosen. Otherwise, they will be, they will be, confusing, and they will be asking about the IOLs even at the time of surgery. So, which is good, which is bad, they will keep on asking. So complications, some people will ask about complications. There are complications. I think, in my opinion, counselor should avoid the question or passively answer it. And if the patient is they are persistent, send the patient back to the doctor, telling that this patient is having some doubts. I think for clearing the doubts about complication, doctor is the best person than any counselors. So pre-op counseling, we have to do some pre-counseling in some case. Suppose pre-operative cataract surgery, OCT macula is a common thing which we do for every patient. So a patient is advised for or planned for fixed for a monofocal, trifocal lenses. Then patient is having an epiretinal membrane or a macular lesion. Then we can send the patient to a retina consultant and discuss with the retina consultant and reconsider the choice of IOL. Sir, it may not be possible for you. That increases the confidence of the patients in your institution as well as in the counseling. And same with the speedo spectra for all the patients. If there is a correlation, you can tell that you may need viscot and keratometry. Keratometry, so like the initial refraction may not show the correct keratometry. So if you do keratometry and if you find the astigmatism is high, then that is the time you need to recounsel for toric. So medical fitness counseling is one of the most important things. Like repeat medical history and history should be asked by every every counselors, and BP and pressure should be monitored for every patient who tells, I am okay, I have now the disease. And this helps the counselors should direct the surgeon for giving the referral letters for the right physicians. A patient is a nephrologist and you are giving a referral letter to physician may not help. And always, we are all practitioners, always, if a patient is asking for a physician or a suggestion, then you send the patient to a physician or institution who are familiar with you, and we will send the patient back to you. When we said if you send a patient to some hospitals, they will not come back. They will get it operated there also. You should know about that.
Alex, conclude.
Yeah. So one last slide. Okay, sir. So that's not end there. Even during the day of surgery, they have some roles to play. On the day of post-op, so counsel is the most important person. They have to communicate with all these people and keep the counselors happy. You can should pay them well, and incentives. I suggest incentives for each counseling, and we should have standby people and keep them happy. And you have to customize your counseling just like you customize other things. Thank you for your patient listening. Thank you so much.
So nice talk by Alex. I am of the opinion that counseling has to be done by the doctor only, because I do it, whatever be the crowd. It's a one-man show for me, but still, because you have a rapport with the patient, by the time you finish, you know everything, as you told, a lot of points. That's true, sir. But I used to feel, because all the medical legal issues and all, would come down a lot, because there's a rapport. It doesn't that easily come. Anyway, that's one point I thought I should say.
It's true.
Shall we go to the next talk? So, getting feedback the talk will be on getting feedback by Dr. Shrikant Karat. What do you say?
Thank you. Good afternoon. In the current ophthalmic practice, where the competition is very high, like we have hospitals, high hospitals every 100 meters, these three words make a lot of sense in your successful practice. When I started my practice in 96, this feedback was very much limited. Patient goes home, they discuss with their family members. If it's a positive feedback, it's a word of mouth, he'll bring back the patient. Now with the online media, the problem is before they leave your chamber, they would have posted a feedback. So this really matters. So you have to look into the patient feedback, reviews and ratings. Initially, I thought all the three are same, but now I found that feedback is the patient opinion that is solicited. You ask for opinion and it's internal. This is the best thing you can do. When you start a practice, always go for internal feedback because it doesn't come into public. So when you start a practice, you have a lot of hitches. So don't let the patients make it public. So when you have a decent practice, when you feel you're settled, you can go for reviews. The reviews are non-solicited. It's open. Anyone can come in. Anyone can see. And negative reviews, the main problem is when you have a negative reviews, you can't delete it. You can't filter it also. It will be there. Then you have to compensate by getting some positive reviews. Rating is nothing. Just a star given to any service from 1 to 5. It may be with or without a review. So again, the importance of feedbacks, it give you insight into the quality of care you are providing. Because you will think, yeah, you are giving a good quality, but from the patient's point of view, it may not be enough. So what they want, you will be able to find out. The patient experience, the areas of improvement, that is more important. Like any areas, like maybe it is a security person or a registration appointment facility, the patient feedback really matters. The staff performance, that is one way. The patient will give you that this optometrist or this reception staff was not good, the appointment was not correct, they didn't pick up the phone. So that you can evaluate how each staff, each department is performing in your institution. And safety concerns, because most of our patients are elderly patients, they may point out, like your that washroom,